Good afternoon. I'm Mark Fox, the Deputy Health Officer for the St. Joseph County Department of Health. Thanks for joining us for a community update on the COVID-19 situation and our response. The County Health Department is reporting as of midnight last night, there are 77 confirmed cases of COVID-19 in St. Joseph County. Those represent 39 men and 38 women. The age distribution, 60% of the cases in St. Joseph County are individuals under the age of 50, I apologize. 60% of the cases are in individuals under the age of 50. The age range is from adolescent up to individuals over 80 years of age. There are currently 6 individuals hospitalized with COVID-19 infections in the county. The number of tests that have been performed in St. Joseph County to date are just under 2,000 tests. We're still awaiting results on approximately 500. Our proportion of positive tests in the county to date, about 5% of all tests that have been completed have been returned with a positive result. That's less than what has been seen, obviously, across the state as a whole, which bodes well for our county up to this point. But as I always caution people, this situation certainly can change on a dime. The doubling rate of cases in St. Joseph County is at approximately 5 days at this point. Again, that's better than many communities around the country, but because there's such a lag in test results, again, those numbers can change in very short order. We continue to see evidence of community transmission within St. Joseph County, which calls for continued heightened attention to mitigation strategies. The goal of mitigation strategies is to prevent transmission within the community, to protect not only the individual, but also to protect others in the county, and also to decrease the burden on our healthcare infrastructure so that we don't see a dramatic increase in number of cases and individuals needing hospitalization. So the attention to physical distancing, the importance of staying at home, and really having no social gatherings. The only gatherings with people outside your immediate household should be for those engaged in essential work activities or necessary functions such as picking up groceries or medications. Even in those situations, in the workplace or grocery store and other places, attention to physical distancing is critical, so maintaining a distance of 6 feet from others. And even out in open air environments with nice weather now, more people will be outside. It's important to maintain that attention to social distancing or physical distancing, even in outdoor environments. The other thing I want to caution people about is avoiding the just this once. So any temptation you have to say, oh, just this once, I'm going to go visit my neighbor or go have a cup of coffee with my neighbor. Don't. Anytime you're tempted to think about just this once, think about not only the risk you're placing yourself in and your household members, but also your friends and neighbors and our frontline workers in healthcare, the emergency medicine, emergency response, emergency medicine providers, and hospital-based providers that care for patients across our community. So at this point, I'm going to turn it over to Commissioner Castelny, who's joining us virtually.
Thank you, Dr. Fox. To give you a quick update on a couple of things the county is doing, and quite frankly, the prime function we have right now is helping support the health department as best we can and the tremendous work that they're doing. It's also in these very difficult times, we still need to perform basic county services. Excuse me. So we've got dozens of people calling in every day because roads need to be fixed and other things need to be done. So we're trying to maintain the balance I've been in constant contact with not only Mayor Wood of Mishawaka, but also the commissioners from Marshall and LabCorp counties, so we can kind of coordinate the efforts and the things that we're doing to make sure that we're keeping each other abreast of the situation, the circumstances, so we can coordinate care as best we can. I think another very significant step is one of the things we'll be talking about later, very quickly, is bringing on Jeff Ray as well to help coordinate from a government standpoint, the different things that are happening because of the issue. We're very grateful that Jeff has decided to step on board with it, but also very thankful to the Chamber of Commerce for really allowing him to serve in this role. I think it's just a great message of what they're doing to help our community in this time when we're kind of calling plays without a playbook here. So I appreciate all the work that people are doing. And I think now it's time for Mr. Ray to take the podium.
Hello, how's everybody? And again, I just want to say that I'm so disappointed that we're having this. You can't hear me too well? Oh, I'm sorry. I'm so disappointed that we're having this issue going on in our country, actually in our world. But again, I want to make sure that we're doing the right thing. I do agree with what Andy is saying because I'm trying to work together and make sure that we're doing the right thing and helping everybody. And I also wanted to let people know that I am praying that God will help us and help our community and help our country and help our world to move forward with. But I am glad that we are actually getting Jeff Ray involved to help coordinate everything and make things more communicative and working together. Because again, I want to make sure everything's updated, done well, and we're helping everybody in our county. And I'd really like to promote our economic development at some point too, because again, I'm disappointed that even dental practices are shutting down and other people are losing their jobs, so I'm very disappointed in that as well. But again, thank you so much, Jeff. I appreciate everything. All right, thank you very much, and again, we're hoping that everything gets updated and improved well. Thank you.
Hi, I'm Jeff Ray, the President and CEO of South Bend Regional Chamber of Commerce. Excited to be here today to really talk about this important new role. And the business community has recognized that this health crisis requires extraordinary cooperation amongst intergovernmental units, the public sector, the private sector, and we're excited to step in and try to provide some assistance. As a former elected official myself, I recognize the challenges of fulfilling the day-to-day responsibilities, as Andy mentioned, but also trying to take on something as monumental as what we're dealing with right now. So I've been tasked with really, I would call it a supplementary or complementary role to what's going on. Mark Fox and the team at the health department, the hospitals, all our medical providers are doing an amazing job really on the coordinated effort, as well as city and county folks. But now more than ever, it's really important that collaboration happens amongst the intergovernmental units, and so I hope I can play some role there. I mentioned that trying to leverage, it's really a public sector solution and a private sector solution as well. I hope that we can help leverage the relationships that we have with some 1,300 businesses in the area, and as we need to try to solve problems or be prepared for things that may come on, we want to call upon those business people and work with the public and private sector to do that. I think that, I think a little bit about the importance of a single point of contact. Obviously, you're going to continue to hear from the mayor and the commissioners and all that. We want to make sure they're armed with the information that they need to communicate effectively to their constituents, but we want to be a single point where folks can reach out to and connect to, and as they have resources or ideas or something, we're really happy to work through those. I'm excited that the health department, in particular, Mark, has been terrific in terms of helping bring us up to speed with the great efforts that they're doing as well. We'll be in daily conversations with them about the response and what the most critical needs are in the community and how we can help do that. And our hope is that we work on coordinating those efforts with St. Joe County and the city of South Bend to make sure we're meeting the needs of the health department to do this. So we kind of laid out a basic basic framework. My guess is that it will evolve over time. I'm thrilled with the chance to work closely with folks. I appreciate the confidence that Mayor Mueller, Commissioner Fleming, Commissioner Castellani, Commissioner Thomas have all placed in me, and my staff and I stand ready to really help navigate this difficult time. And then I would mention, Commissioner Castellani mentioned it as well too. I've already been in close contact with Mishawaka. Mayor Wood has been very gracious in including me in whatever we want to be included in over there. So there's a great deal of coordination that'll happen on that front as well too. We hope it's a short-term thing. It may be a long-term. We don't know. And I think Mark gave some terrific advice at the beginning of this, that it really is up to us as a community to do the things that we need to do to really help flatten that curve and slow the spread of this. And so all of us are working really night and day to do this. And if I can provide, me and my team can provide some resources that help the city and the county address that quicker than expected, we're glad to do that. And we've got our sleeves rolled up, and we're ready to go. And we'll look forward to working with everybody on that. So.
Good afternoon. My name is Aaron Perry. I'm the Executive Director of the City of South Bend's Venues, Parks, and Arts Department. Over the past couple of weeks, it's become increasingly clear that resources are needed throughout our community, and one of the top, most pressing critical needs at this point in time that we've identified is food security. We've been working very closely with several partners throughout the community to ensure that all the bases are being covered and that at the very basic minimum, people are fed throughout this crisis. I want to recognize the work that is going on with several of our community partners that are taking the lead here, including the South Bend Community School Corporation, who is distributing close to, I believe, 5,000 meals a day right now. Real Services, who's out servicing our seniors with the meal delivery program. The Food Bank of Northern Indiana, who's not only doing a drive-through pickup model, but also a food distribution through about 70 different food pantries throughout the community, and of course those services that continue to provide for the unsheltered. All of these folks are doing great work. There's resources on the City of South Bend's website, as well as 211, which is available through the United Way, to find out where all these resources are available. To that end, we want to make sure we're doing our part as a city as well. There's a couple of things we've identified to help. One thing is a fundraiser. Some of you have seen already our t-shirt program, the Side by Side, Together Even When We're Apart t-shirt campaign. I've got samples of them. This may not work as successful as I might have thought, but there are Indiana versions and South Bend versions. So Together Even While We're Apart. Thank you for bearing with me on that one. Those are available on South Bend Venues, Parks, and Arts website. You can find that on our social media as well, hashtag Side by Side. Those are selling for $25 each. All the proceeds go to the United Way's COVID-19 Emergency Response Fund, which is helping fund food security and several other critical needs throughout our community. The other thing the city has done as we identified food security as a need is establish a partnership with Stan's Food Service. Through the City of South Bend special appropriation that Mayor Mueller and the Common Council made available last week to the tune of $500,000, we've appropriated $50,000 of it for a partnership with Stan's Food Service so that these agencies can continue to have a consistent supply of food product as we navigate this crisis. Our staff at Venues, Parks, and Arts has also been redeployed to help serve alongside several of these agencies. I think we have about 35 full-time staff members who are working alongside Real Services, the Food Bank of Northern Indiana, and Cultivate Culinary to ensure that nobody goes hungry throughout this. This is just one example of one city department, how we're stepping up. I know my colleagues across the city are doing their part to care as well. And I know many organizations out there are doing their part. And Mayor Mueller will highlight some of those because surely that's the only way we'll navigate this storm effectively as a community. With that, I'd like to turn it over to Mayor South Bend, James Mueller.
Thank you, Aaron, for all your efforts. Good afternoon, everyone. For those at home, our media partners here are also virtual, and that's to make sure that they're safe and protected. It may not be the video quality production that we're used to on our news, and as this goes on for some time, hopefully we'll have better production quality in the coming weeks. But first, I'd like to thank Jeff Ray for his willingness to step into this newly created COVID-19 response coordinator role. As we confront the unprecedented public health and economic emergencies before us, we need all hands on deck to be synchronized in our response. I also thank County Commissioners, President Andy Castelny, Deb Fleming, and Dave Thomas, as well as our County Health Department for all the coordination efforts so far. But this new formation will enable us to be more efficient and unified as we also work closely with our state and federal partners. I'd like to highlight some new changes to the city website, which already has a list of resources from organizations and individuals throughout the community. With the help and hard work of Hamina Holguin with the University of Notre Dame Center for Social Concerns, we now have a full Spanish language translation for all of the resources listed on the city site. And in partnership with the St. Joseph County Health Department, we're also publishing a dashboard that tracks both statewide and county level cases of COVID-19. This new tool will help us all understand and see where we are in this outbreak. My team and public servants throughout the community continue to work to solve issues that this pandemic presents. We are working to adapt and prepare for the coming surge in cases and the economic fallout of our distancing measures. Unlike most other emergencies, there will be no cavalry arriving to reinforce us. Because this is a global pandemic, everyone else is facing the same issues. But our community is strong and ready to take on these challenges together. I've been encouraged to see an outpouring of support from our community. So Loved has developed a plan to sew mask covers for our healthcare providers to help alleviate the supply shortage that exists nationwide. Our South Bend Community School Corporation has adjusted to a new role while continuing to provide necessary meals to our children and finding a new way to educate them remotely. There's the work of local businesses like Indiana Whiskey and TriPack, who shifted their manufacturing processes to make hand sanitizer, which they have graciously donated some to our healthcare systems and first responders. Work like this will help us get through this crisis together, and I am so grateful to the many others that I haven't mentioned who are doing their part to help as well. It's especially important to remember and honor the vital work being performed by our first responders and healthcare workers as they help us navigate this pandemic. So today, I'm ordering that beginning tonight, the river lights will change to red and white, like other landmarks across the country, to recognize their contributions and sacrifices in our fight against COVID-19. We must continue to recognize their work and the unprecedented challenge that they face. To all of our first responders and healthcare workers, from our firefighters and police officers to our physicians and nurses, I thank you for your work, and please know that we will do everything we can to support you. All of us can do our part to support our neighbors on the front lines and our neighbors who are most vulnerable by mobilizing at home. It's imperative that all residents take the governor's stay-at-home order and the CDC guidelines for physical distancing seriously. It is not okay to have in-person group gatherings of any kind. It is not okay to visit with friends and families outside of your household. Staying home and avoiding contact with others has likely already become a trying experience. But the reality is, it's the most important thing you can do to help slow the spread of COVID-19 in our community. The choices that you make today and for the next several weeks will determine how many of our neighbors live or die. Please think about that when you're going about your day. These extreme distancing measures are in place because the only safe assumption and strategy that we have is that everyone could be infected and contagious even without symptoms of illness. No one knows how long this will continue, For now, we find ourselves at the mercy of the virus's timeline. We talked earlier about where we might expect our peak locally in our community several weeks from now, and that means it's a likely bet that we'll continue distancing measures through the month of April and at least part of the month of May. I know this will be difficult, but we'll find a way together. Thank you all for doing your part. I'm proud every day of the residents and businesses of South Bend who have risen to the occasion as we confront these unprecedented challenges together. And with that, we'll open up to questions.
So for members of the media, I will run through the list. And could you start off, one, by remembering to unmute your microphone, and two, by mentioning which person you would like to direct each question to so they can come up to the podium. So we'll start with Anna Caroline Caruso with WVPE.
Hey Caleb, yeah, I don't think I have any questions right now.
Okay, thank you. We will move to DJ Manu with WSBT.
Yes, thank you. This first question goes to Aaron Perry.
Yeah, hi, DJ.
Hey, Aaron. So we've all been saying that it's nice to get outside and go for a walk. It's recommended to try to break up the cabin fever. I did this today, and a lot of the basketball parks had the playgrounds. They're closed off, and basketball hoops got taken down because there's been people commenting saying that people are still gathering in bunches there. In terms of parks, what are you guys doing to make sure that people can still go for walks, but they're not crowding them to stay safe?
Yeah, thanks for the question. I appreciate that. And there has been some confusion around that. First and foremost, you really shouldn't be gathering with anybody, as the mayor said, nobody that's outside of your household. So whether or not you're inside or outside, whatever the case may be, no gathering with anybody that's outside your household. Number two, the parks, all of the amenities that you come to know and love in our parks, whether they're basketball courts, playgrounds, tennis courts, those are all going to be closed. We've put caution tape around the areas where appropriate. In some instances, we've had to take a little bit more extreme measures, like removing basketball hoops, just so people don't have that temptation right there in front of them. I can't think of anything worse than being in close contact in a sweaty environment, playing basketball in this environment right now. So all the amenities remain closed, but the open park spaces are still there to take a walk, ride your bike, walk your dog, go for a jog, whatever the case may be. But again, maintain your physical distancing. Don't go outside at all if you're sick, showing any symptoms. And of course, no gathering with people outside your immediate household.
And then my other question is for Dr. Fox.
Yeah, DJ.
Let's go, Doctor. So you were mentioning the fact that where we are right now, 5% of the total tests are coming back only positive. In terms of that number, is that a positive sign for right now? I know everyone's talking about the recovery side to it, but in terms of the number of tests we're seeing, that's a portion of it is only coming back positive. What are you looking at? Is we get closer to that peak level? Is this number supposed to fluctuate at all? Or is this kind of better than what we expected?
Yeah, that's a great question, and it's actually a tough one to answer. So, I think there are two parts to it. That only 5% of our tests have come back positive so far, and we've been very proactive in terms of closing the schools and promoting work from home and promoting, extreme physical distancing. So we've taken those steps over the last couple of weeks, and so that only 5% have come back positive so far. We hope that the risk decreases as we go forward because of all the measures taken at the local and the state level in this 2-week period. The proof will really be over the next 10 days or so. We still have also not tested extensively in our community. We've done 2,000 tests, mostly targeted at individuals that we believe to be at high risk based on a history of exposure, either in travel or exposure to a known case. So we've had a very limited view of people in our community. We know that there are others in our community that have been infected that haven't been tested, or we assume that there are others in our community who are infected that haven't been tested. That's why it's so important that everyone observe the stay-at-home order to reduce the risk that someone who's asymptomatic or has not yet developed symptoms reduces the risk of transmitting the virus to anyone else in our community.
Thank you.
Thanks, DJ. We'll move to Jeff Parrott with the South Bend Tribune.
Hey, sir. I don't have any questions. Thank you, though.
Okay, thanks, Jeff. I think we'll go next to Mark Peterson with WNDU.
I know a couple of times supplies were mentioned. You kind of showed what we're trying to order. Are we not getting it?
Yeah, Mark, is there a specific person you'd like to answer that, or?
Whoever wants to swing.
Okay.
Supplies, access to supplies.
And would you be able to repeat that question, Mark?
Just the whole issue of supplies. I think Andy Scully had mentioned that they tried to order some today. I'm just wondering what types of supplies we're good at, what types of supplies we're shy of.
So the question is about protective equipment and supplies. The local hospitals recently received another shipment from the Strategic National Stockpile. So they've received now multiple shipments over the last week or so, which has been helpful. The bigger challenge is ensuring adequate supplies for long-term care facilities, shelters, the jail, and other environments that haven't received shipments from the Strategic National Stockpile. We've been fortunate in that, companies across the community, the University of Notre Dame, Ivy Tech, a number of places have donated gloves and gowns and masks and things, and we've been able to distribute those across the community to long-term care facilities as a priority. So right now we do have supplies, but a lot of our preparation is planning for and preparing for the peak, and the mayor alluded to this. There are several different models that project when the peak is likely to hit. There's one model that projects in the state of Indiana, our peak is 16 days away. So our peak resource utilization is projected for April 19th. That's for the state as a whole. It's difficult to project exactly for our community when that will be, because we obviously serve individuals from well beyond the boundaries of St. Joseph County in our area hospitals, and we have to be prepared for that. So we've worked closely with the health systems as well as with the State Department of Health and the Indiana National Guard to really prepare for how we increase our bed capacity. But that's why it's so important that medical grade masks are prioritized for the hospital setting to keep our healthcare workers safe. If a proportion of our healthcare workers and EMS responders are out on quarantine or are out sick, that will have the potential to have a devastating impact on our ability to provide care for people in our community. So it's important that the medical grade equipment is prioritized for those settings to keep our workforce safe in caring for the planned increase in patients that we anticipate likely over the next 3 to 4 weeks. So our extrapolation of the model suggests that it won't be as soon as 2 weeks, but probably in the 3 to 4 week range in our region. And again, I think that's because our elected officials and schools were very proactive in responding in encouraging people to work from home and encouraging physical distancing very early in the impact in our community to reduce the transmission.
And it's Jeffrey, I think it was a little audio glitch when you mentioned leveraging, having 1,300 businesses at the table when problems arise. What was that again?
short, I just generally think it's really leveraging the relationships with some of those as the health department has looked for particular things. We've reached out to manufacturers who could potentially prototype equipment, who could potentially shift what they're making, maybe do something different. And so, so as we go through this, our thought is because we already have those relationships, we know who's doing what out there. It'd be beneficial to make some connections there if we get to the point where we need to make some of that stuff ourselves. And maybe I would add the other thing too. We've talked about just whether it be hotels or just different kinds of businesses like that. Again, those are relationships we work really close with in the past. And so as we think about if we need to house some people temporarily, how do we do that? Where do we do that? And can we convince some folks to do that for us?
Let's go now to Jonathan Bailey with ABC 57.
My questions are for Jeff.
Okay.
My first question is, have you guys gotten any word on why Mishawaka has not physically joined this task force?
As we mentioned earlier, I had a great conversation with Mayor Wood yesterday. Mayor Wood asked or invited me to attend any events, any meetings with his team, reach out to any of his team. So I think they're very much a part of this. Obviously, what happens in the community doesn't stop at the political boundary. We'll work closely with his office as well. Actually, that's where my history is. Have some great relationships over there. So I think that it was just a difference of opinion on whether it needed to be formalized into an agreement. We look forward to working with Mishawaka as we go through this.
And then my second question is kind of a follow-up. How effective can this task force be if the second biggest city in the county isn't actively issuing stay-at-home orders or actively a part of the task force?
Again, I think they'll be very much a part of the discussion. I don't anticipate that. They just are coordinating that in a different way. But obviously the teams in South Bend and St. Joe County will work closely with it. It is the St. Joseph County Health Department, and so it has jurisdiction over the entire county. And the citizens of Mishawaka are subject to the same restrictions that everybody else in Indiana is. And so as Governor Holcomb has put some guidance out on gathering and stuff, those same things apply to folks there. The same recommendations that the mayor just made here in South Bend apply to whoever's listening or watching this, because everywhere in the viewing area, those are great recommendations in terms of trying to limit this. And so it's really going to take all of us to do this.
Thank you.
Let's go now to WETL Radio.
I don't have any questions right now.
Okay, thank you. That looks like that's everyone, but I just want to make sure if anyone had any follow-up questions, let us know.
Okay, well, we got a text question. There was a question about
We had
test results.
one additional question coming in via text on test results, so Dr. Fox will address that.
Yeah, so I mentioned the number of test results outstanding. The average wait for a test result to date in St. Joseph County is just over 6 days. It's actually come down about a half day in the average this week alone. So we've had some test results taking 10 days or more to return. Working with LabCorp, they are beginning now to be able to prioritize tests that originate from providers in St. Joseph County. And already in the last 2 days, we've begun to see more rapid turnaround in test results. So we certainly expect that trend will continue. And that bodes well for our community, because right now we're living with data that's 6 days old. So we're eager to see the continued reduction in the turnaround time for those test results.
I have a follow-up.
Okay, Jeff, is that for Dr. Fox?
Yes.
Okay.
Yeah.
Hi, Dr. Fox.
Hey.
on the LabCorp testing, does LabCorp now have the ability to process local tests here locally at their South Bend facility?
So LabCorp over the last week or just over a week now has been, the South Bend site has been a processing site for their company nationally. They've been working through a national backlog of tests. My understanding is they, this week, have received some additional equipment that's coming online, and they have committed to using that new piece of equipment for processing local test results. And so with that, we expect to see continued improvement in turnaround time for tests that are obtained here in St. Joseph County.
Thank you.
I've got a follow-up for Dr. Fox.
Okay.
Dr. Fox, when it comes to manpower, specifically with respiratory therapists, how prepared is the county as far as having enough personnel in order to deal with this crisis?
Yeah, I can't speak specifically about the respiratory therapy workforce. That certainly is critical as we're talking about patients with respiratory illness and the risk of respiratory failure. We have been working with the health systems not only to increase the bed capacity, but also to increase, to the extent possible, access to ventilators and other forms of respiratory support. But I don't know off the top of my head exact numbers related to respiratory therapists, but that certainly is a rate limiting step into how dramatically we can increase access in our community.
Thank you.
All right, everyone. Thank you very much.